Okay,
Dave,
wait
can you hear me?
a second. You are recording.
Hey, Dave, can you hear me?
I hear you.
Yes.
Yes.
Yes or no?
Yes, I hear you perfectly.
Okay, great. It's just loud in this room. Are you ready to start the meeting? I'm ready.
Okay, anytime. I'm recording.
Sorry about that, everybody. It's the first time of the first year, the new year, so we need to do it really loud, don't we? I want to welcome everybody to the Rotary Club of Kerrville. It is so good to see you in this brand new year. Maybe we have great new things happening for us, and we have this beautiful snow, as I talked about in our email, that I felt like just cleansed us from the mess that was 2020, and we could go forward and have some great things happen in the new year. So welcome. I want to ask you to also turn off your cell phones, but before you do, sign in to Facebook and let everybody know you're attending your Rotary meeting. Also, our guests on Zoom, please make sure you're muted. Your computer's muted during the meeting. So that's it. So welcome. Mainly, I just want to say I'm so happy to see each of your faces. You don't know how much. I would also like to invite Jeff Winling to come and say our pledge and lead us in, come say our invocation and lead us in the pledge.
Please bow with me. Father God, we come to you in prayer today, and we're thankful for all of your blessings. Father God, a special prayer for those that are feeling bad and trying to overcome, particularly our friends and relatives who have COVID, gastrically in them. And Father God, we ask another special prayer for our country as it meets a crossroads. Please help us to be able to manage that in a way that's to adopt the Rotary phrase, spare all concern. It's a tedious time for all of us. And Father God, we ask that you bless this group, we bless this club and this leadership, be able to continue on in these hybrid meetings, and everybody is feeling fulfilled with the Rotary mission. And Father God, we ask that you bless this food to the nourishment of our body. And we ask all these things in the name of your Son, Jesus Christ. You'll turn and face the flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Nice. Thank you, Jeff. Okay, now I know all of you have a lot of questions about the vaccine, and Amber is going to be able to give you as much information as she has, so I'm excited to have this meeting, have her with us today. Clint, would you like to introduce our speaker?
Thank you very much, President Tammy. Before I introduce the speaker, I need some help from the club. Somebody recommended to me that we get a speaker from HEB who was responsible for getting us the new store. And I can't remember who it was that recommended that. I need to talk to you. Thank you. All right, now, our speaker, a real success story for the youth of Kerrville. She grew up in Kerrville. She graduated from Tybee. She began working in the pharmacy at HEB as a technician. She then began to go to school at Incarnate Word. And after a number of years, she graduated with not just a degree in pharmacy, but a doctorate in pharmacy. She came back and continued to work at HEB and is now, has been recently promoted to the manager of the pharmacy. Now, I can tell from the turnout that we must have hit the right note because we've got a great turnout and a really interesting issue about, we know that the vaccine is here, but what's going to happen from now on? So without more, let's give a warm Rotary welcome to our speaker, Dr. Amber Burress.
Click here. Now do participant.
How are you guys doing? Good. I'm excited to know about the vaccine, I'm sure. So I'll go over a little bit about the vaccine itself, what is available right now, and a little bit more information about the misconceptions of the vaccine, and then we'll go into how it's affecting Kerr County and how we can get it distributed to everyone. Let me pull up the PowerPoint real quick. Is it right there? We go. So then, can everybody see it on the Zoom?
I see it. It's fine.
Okay, good deal. All right, so let's just go straight into it. So the two vaccines that are currently available right now that are out in the public are both COVID-19 mRNA vaccines, Pfizer and Moderna. And I'm sure you've heard of both of them, that it's been in the news. And but one thing that is special about these is that they're both the mRNA vaccine. So what does that mean? It means the mRNA is how the vaccine works to help fight this virus. So this is a little bit, I'm trying to explain it in layman terms because it's kind of complicated, but basically the spike protein is a copy of a little piece of protein that's on the actual COVID virus, on the virus itself. So what the vaccine does is it is input into our immune cells, which are basically the mRNA, the virus, or excuse me, the immunization is instructions on how to make this spike protein. So the instructions go into the cell. The cell will then copy those instructions, make the spike protein. Then the mRNA vaccine actually disseminates. The cell breaks it down and gets rid of it. All that's left is the little spike protein. That will be put on the outside of that immune cell for your body to recognize it as foreign. At that point, your body will then develop antibodies that will help fight the COVID virus. So that is how all vaccines basically work, is that your antibodies will see it as foreign and then know how to fight it when it comes into your body, if you come in contact with it. So this is just a way to make the spike protein that is the same on the COVID virus. Does that make any sense?
This is Dave Rittenhouse, the moderator. Microsoft, in its infinite wisdom, has a little screen up there that's obscuring part of your slides.
Do that. How do I do that? There. Is that better?
I think that's all you had to do. Okay.
All right. Thank you. Is it on there too?
But Microsoft knows much more about what you should be doing than you should.
Okay. All right. So where are we at? Yes. So what we went for. So the facts about the mRNA vaccine. So just some basic information, some misconceptions that are out there. It is not a live virus. There is no possible way that the vaccine can give you COVID-19. It's just a little piece of a copy of it to show your body what it is, but it is not the vaccine, or it is not the virus itself. It does not enter the nucleus of the cell where your DNA is kept. So there is no interaction with your body's DNA with this vaccine. There's no possible way. And there's been a lot of misconception out there and a lot of questions about it, but it does not ever actually enter the nucleus. And then lastly, it will break down that mRNA, the cell will, so there's no mRNA left in your body at that point. It's just the instructions on how to make this protein. And then after your body develops antibodies, the protein disappears as well. Any questions so far? All right, so the safety of the vaccine. So both of these vaccines were tested in about 30 to 40,000 people. If I remember, the Shingrix vaccine came out very suddenly as well. It seemed like it was fast-tracked. It was also studied in about 30,000.
Yeah, we're muting you so they don't hear you. They,
Please go on mute. I'm going to put you on mute.
So, like I was saying, the shingles vaccine came out in 2017, and it was also studied in about 30,000 people. And it was such a good vaccine that we fast tracked it and got it out to the public as soon as possible. The same thing is happening with this. The only difference in this vaccine as far as the trials, yes, it was fast tracked, but the part that was fast tracked was getting the approval to do the studies. That part was negated because it was such a necessity to get it started. So that's why everything seems like it's been super fast, but that's because we skipped that one section at the beginning. That was the getting the approval. There are no indications that this vaccine is going to work any less or any safer than, or any less safe than any of the other vaccines that we have available right now, or regarding flu, Shingrix, pneumonia. It all has the same safety profile. The most common side effects with any vaccine, and this one, is arm pain. It does hurt pretty bad. You can get redness at the side, chills, fever, and fatigue. Fatigue is the most common. You just feel really tired and kind of crummy for a couple of days. So just make sure you have some time off. If any of you have had the Shingrix vaccine, you understand that that one's actually way worse than the COVID vaccine. All right, so there's another part to safety after you're given the vaccine. You're given a piece of paper that has this information. It's called VSafe. So what this does is basically gets aftermarket information as well, other side effects. So I've registered for this. You register, and they'll ask you which vaccine you got. Whether you got Pfizer, Moderna, and the lot number. And then it'll ask you simple questions and have your phone number, and it'll text you every day for 3 or 4 days. And then it'll be weekly, and then monthly, and then it'll just go to every so often. But they'll ask you if you've had any side effects. What are they? It's a little click box. Super easy. It takes less than 2 minutes. You click, oh, yes, I had pain in my arm. And then if you say yes to one, they say, well, how mild, was it mild, moderate, or severe? Super easy. So when I got mine, it wasn't severe. It was had pain. It was mild. We're good. It asks you, did you have to miss work for any of these things? Literally takes less than a minute to answer the little text. So this is very good information to help get out more safety information than what we know just from the trials from the 30 to 40,000 people. All right, so restrictions. Everybody wants to know, can I get that vaccine? So here are the only real restrictions. If you have tested positive for the COVID-19 virus, you have to wait 90 days before you can get the vaccine. You can also not get the vaccine if you've had any other vaccine in the last 14 days, and you cannot get any other vaccine for the next 14 days. That's what they want to keep that vaccine by itself. So that if you have a reaction, so you get another vaccine and you have a reaction to that, how do you know which vaccine it is? And because this one is so new, we want to make sure to keep it secluded and by itself. So you would not do any other vaccines for 14 days. If you had a serious reaction to the first dose, you're restricted from getting the second dose, of course. And then the other one is if you've had a serious reaction to other vaccines. We believe it's most likely the preservative that's in the vaccine that would be causing the issue. So that's when we just want to make sure that if you've ever had a serious, and when I mean serious, I mean like anaphylactic shock, you had to use an EpiPen, bring you back, very serious reaction, we're not talking arm pain or fever. Those are the only things that would actually restrict you from getting the vaccine. Okay, so what do we have? So these are the two that are available. Moderna is the only one that I'm aware of that Kerr County has received at this point, but Pfizer is out there, so I'm not sure. I think the VA discussed them, and I don't know which one we got. But okay, here's the information. So they're both administered in the arm, up in the shoulder. Pfizer is approved 16 and up, Moderna is only 18 and up. It is a 2-dose series. The Pfizer is 21 days apart, so 3 weeks apart. The Moderna is 4 weeks apart. We have been given permission to do it between days 24 and 28. So that gives us a little bit of an area there to work on. If you can't get there on day 28, it's still possible to get it and still be effective. If you miss that day 28 and it's late, you can still receive the vaccine. You do not start over. There's just no guarantee that that vaccine is going to be as effective as they've stated at day 28, 24 to 28. So the efficacy, Pfizer has 1% on us. It's 95% beginning 7 days after you've received your second dose. Moderna is 94% effective 14 days after the second dose.
One of the things that we have instructed to everybody is just because you have the vaccine, do not think that you are completely immune. That means you're 95% to not get the vaccine. But that doesn't mean that you can't do that 5% that still gets it. So you still want to protect yourself until the majority of the public is immunized. That's when they're going to have to consider that herd immunity. And then we can start removing the masks and social gathering, and just like we do with every other illness that's out there. All right, so what you really want to know is how are you going to get it, right? When am I going to get it? So here are the tiers. I'm sure y'all know them. 1A, right? Long-term care facilities. We've got to take care of our nursing homes. And then direct care. So hospital, EMS, pharmacies, school nurses, those people that work directly with patients who could potentially have COVID. There's no getting around it. There have been some issues. Some dentists have been a little upset. Rightfully so, they're in your mouth doing everything. But because they screen and don't see COVID positive patients regularly, that's why they are not included on the direct care list. So 1B, that is our next step. So once we get through 1A, we switch to 1B, 65 and older. And then it says 16 and older, we only have Moderna, so it would be 18. 18 and older that have a chronic medical condition. Here's some listed here: cancer, diabetes, type 2, obesity, pregnancy. A whole other thing with pregnancy, you need to make sure that your doctor's okay with it. But COPD, these are really important comorbidities that can have basically, if you have these comorbidities, you are at a greater risk of having a serious reaction to COVID. You're So that's why they are included on the 1B. After that is what's called 1C. We don't know what 1C is. It's to be essential workers, and then it was to be everybody. We don't even know yet. So the state, if you look under it's under the Texas Department of Health Services, it says still under review. So I don't know what 1C is going to be or when we're going to get there. Okay, so Kirk County, here's the information that I have now. What I do want to disclose real quick is that we're having a Zoom meeting a little bit this afternoon to go over even more information. So as we get it, you will get it. Okay, so we're still currently on. We have over 3,400 healthcare providers in Kerrville. Not talking about dentists, not vets. We're talking about direct care, professional medical personnel that need this vaccine. There have been 1,600 sent to Kerr County. That's it. There was only 100 sent this week, and that was to family practice. And so our biggest obstacle is getting the vaccine into Kerrville so that we can immunize 1A and then move on to 1B. And as you can imagine, it's been a little bit crazy because the media is displaying, oh, you can do 1B, get out there and get your vaccine. We can't do that in Kerr County because we don't have it to give it to you. And it's very frustrating. We want to be able to do that. I have a list of healthcare employees, a pretty extensive long list. And then I had started making a list of our customers 65 and up before they had changed it to add the 16 and up. And the list just got unreal. It's absolutely crazy how many people. So what we're doing is we're actually working with the Kerr County Emergency Preparedness group. So what we have decided as a group, and we will not move to 1B until we have exhausted 1A. That's every provider in town. So once we have the vaccine that are actually distributing to the population, there's only 1,000 of those. The hospital, both HEBs, medical arts, and family practice. So all of us have decided and agreed upon we're not going to move to 1B until we finish 1A. So we're going to all move together. So there's nobody that's going to get an edge on anybody else. Okay. What we want to do is a community-wide clinic. It will most likely be in multiple locations throughout the county so that everybody has a chance and we're not all running to one place. We're still working out the planning. What you can be sure, and I think I've already skipped that part, what we can be sure of is that we will, we have been planning this for over 10 years. I don't know if any of you have attended the annual flu clinic out at the Ag Barn every year. HEB hosts it every year along with the hospital. The emergency preparedness team is there every year practicing for this right now. Like they've always practiced for, if there's ever a time we need a vaccine mask, here we are, we're here. Our only issue right now is getting the vaccine to Kerr County. So as soon as we can get it here, we're all gonna pull together. So you're not gonna have, oh, well, I have to call HEB, or now I have to call my doctor, or who has it. We're trying to make it streamlined and easy for Kerr County as we can. So we will all pull together, give you a location to go and get your vaccine. We wanna make sure we have massive amounts so that nobody's left behind. We're just waiting on the state and getting approval. So that's kind of where we're at right now. I think that was pretty much it. There will be a press release tomorrow after we meet this afternoon that will give everybody more information. There'll be stuff in the newspaper, it'll be online, so you can reach out and get information there. Because unfortunately, we don't know a whole lot right now. We get questioned a lot. Unfortunately, we just don't know. It looks most likely that it's going to be February, maybe even March before we even get to 1B. Yeah, it's not by choice. I was all gun ho. I started taking my list down and I was like, okay, I got this. And then once we get healthcare, we're good to go. And they gave us the shot that first week, and then there's been nothing. And so it's very hard to move on when you don't have anything to move on. And we were all ready to go run for it and do it, and it's just been kind of halted. So we're kind of at the mercy of the state right now. I'm just waiting for it to be sent to us. That's it. Do you have any questions? This is where you can also go to get more information at the Texas Department of. Yes, sir, Mr. Miller.
I've had a relative that lived in New Braunfels that was 65, and she got at her doctor's office the other day. And I'm curious how the state is allocating the resources as far as which counties, for example, with Kerr County having a fairly large population of senior citizens, how they're allocating and figuring out how to do which counties and how much shipments you get.
Unfortunately, we don't know. Nobody knows how the state is deciding allocation. What I can tell you is that the state gave permission to move to 1B if 1A has been exhausted, or because of the way we have to give the vaccine, it comes in a vial of 10. Once you've punctured that vial, it expires in 6 hours, no matter what, it's trash. So they've said, if you don't have enough, like you didn't have enough healthcare workers that came in that day, you vaccinate someone. So then you can move to 1B. That started a huge stir, and now everybody is very concerned with getting it. And we're trying our best to get everybody in order. Kerr County, we want to honor what we're supposed to do. We want to make sure that we get all of 1A, those that are in the middle of it every day, those in the ER, those, at your doctor's office checking your COVID test. CVS is doing testing, but they didn't even get the vaccine. So we immunize CVS employees. So it's things like that. We need to get them taken care of, and then we can move on to the next group. And unfortunately, different counties have done other things. And so it's making things very confusing. Yes, sir.
Is the second vaccine or second shot the exact same formula as first, or is it different?
It's the same exact formula. However, when they're sending it out, the vial itself says second dose. So we cannot give that as a first dose to anyone else. And that is to guarantee that the people that came in for their first dose get their second dose on time. I've read that they're trying to possibly change that, and I'm really hoping that they cannot. But as of now, when they send me that second batch, I can't give it to anybody as a first dose series, if that makes sense. Those are reserved for the 100 that we gave already.
Amber, I'm going to remove your presentation from the screen if that's okay.
Yeah, sure.
So now we get to see you in a big screen. Made the big screen. Okay, there's probably people online that have questions, but the problem with being online is you put them on mute, and it actually takes a few seconds for them to come off mute. So certainly.
And this gentleman has raised his hand a few times. Yes, sir. You had a question?
I do.
Yes, sir.
So long ago.
I'm so sorry. No, I know. I was like, oh, I'm trying to get to you.
Taking the planner out. Initially, one day was set up for law enforcement.
Right. So 1B was set up for essential workers, which included law enforcement, all of the other fire department, everybody else. So the government, federal government left it up to the states to decide the tiers. Texas decided to follow closely with what the ACIP recommended. ACIP actually recommended to do essential workers and 75 and older. The state of Texas decided they wanted to do 65 and older and those with comorbidities. It will cause the floodgates to open, unfortunately. I'm afraid that there are going to be those who do not fit that criteria that claim to. And I think that's going to cause some issues. But if you're an essential worker with a comorbidity, if you've had a heart condition or you've had other issues, any of those that listed earlier, you can get the vaccine in that point because you fall into the comorbidity.
Amber, I've got some people here. Here's Lucy.
Yes, I have a question. Speaking of comorbidities, so when somebody comes in the 1B group, will they have to provide medical proof that they have a comorbidity?
Is that where you're going? So at this point, we have to have that discussion. We don't know how we're going to require that. How do you require to prove somebody that they're obese?
I'm sorry, I can't hear. What was?
The little one.
Okay, can you start over, please?
So it depends. Honestly, I don't know the answer to that yet. We're having a meeting this afternoon to see how we can do that. Because honestly, we don't know at this point. We're kind of, how do you make somebody prove that they're obese? How do you make somebody prove that they're pregnant if they're not showing? I don't know. And I don't know that we're going to have to require proof. If you follow what the state of Texas is stating, you don't have to have proof. And I don't like that. So we are having a meeting this afternoon to decide how we're going to do that here in Kerr County when we do our clinic.
Thank you.
I have a question. How long does it last?
How long does the vaccine last?
Yes.
Hopefully it's a one and done, depending on if it changes. Now there are changes already. We've heard to the COVID vaccine that it's not mutated, but there's another strain out. But so far the same spike protein is on there, so it shouldn't be an issue. We're hoping it's one and done, but we don't know for sure. Unfortunately, there's not enough study out there.
All right. Thank
I
you.
don't know who to go to next. I'm sorry, because I know I didn't get to finish with yours, sir.
All the contact in that case, we've come to a ridiculous circumstance.
No, I completely agree.
I just wondered what the official line was. I can't find out.
So officially, they would most likely be under 1C. But like I said, if any of your law enforcement have a medical condition, they can get the vaccine. There you go. There you go. Then they can get the vaccine. I mean, honestly, I'm sorry. I wish I do not like it either. I don't necessarily agree with the state. I just have to follow the rules unfortunately. I know he had a question, then I'll get to you. Sorry. Yes, sir.
And what happens if it's not?
So originally, and as far as I know, still stands, when they send me on 100, they put 100 back, they slap that second vial dose label on there, and they will send that to me, hopefully the week before it's due. We've been told that it was guaranteed that you will get it. I've seen things suggested to get mass quantities out that we hold off on the second dose and we get everybody the first dose. I don't know if they're going to change their minds. But as of right now, at this moment, they're guaranteeing my second dose to come in and then I can dose them. And we have to verify that they've had a first dose in a system before we can do the second dose. And they have to have a little card. When you get the vaccine, you get a little card that says when you got it, how much.
I think Joe Cavanaugh has a question online.
Okay.
Joe, are you able to, you're off mute, so do you want to speak up?
Yeah, I put it online. I tested positive in the middle of December. I understand that I must wait 90 days to receive the vaccine. Is this correct?
Can you hear me? Yes, sir. That is correct information.
I have a question.
Yes, ma'am. Go ahead.
So my question is, how, is there going to be some sort of appointment protocol, or how are you systematizing the actual vaccinations?
Right now, we're only doing 1A, and we do require their health license when they come in to verify that they are an active healthcare provider. 1B, we're still sorting that out. And again, we have a meeting this afternoon with all the vaccination providers, along with the emergency preparedness and the task force. So we'll try to plan that as best we can. We're trying to discuss that and figure out the best course of action. I know you've been patiently waiting.
Contract with someone to provide the vaccine. So we had Walgreens, and we did the Pfizer vaccine. We got it on the 1st, and we'll get ours on the 21st.
Very good.
With 78 people that received the vaccine, out of that, 1 resident had side effects beside the sore arm, and 2 employees had side effects that were different from the sore arm. From what we understand and from what I'm seeing, the older population seem to be tolerating the vaccine a lot better than the younger population.
That is true.
Both of my employees are definitely younger than the 1 resident. She had a headache. They had other flu symptoms.
Yes, and I've heard that as well. And so they're actually saying that when we get to the essential workers, the younger, that they should probably make sure, like if it's a company, you don't do everybody on the same day, because you might have massive call the next day.
This is moderator. Now, whenever somebody asks you a question, please repeat it so that those of us online can hear it, because we can't hear people in the room.
Okay.
As well as we hear you. Although I have somebody that can't hear you, but I can't figure out why. Lucy, is that what you're?
No, I do have another question if it's my turn.
I'm not sure he was done. I'm afraid I might have interrupted Amber, and I didn't mean to.
Are you ready for my question?
Amber, were you done?
Sure.
Go ahead, Lucy.
Okay, I have a question. What about, you said that you're not authorized to give although the second vaccine is identical to the first, you're not authorized to give it as a first vaccine. What about, what are you going to do with those second vaccines when people don't come back to get their second vaccine for whatever reason? Because they've gone somewhere else, or they've decided they're not going to want the second vaccine for whatever reason.
So I haven't we haven't gotten to our second vaccine yet. So the 19th is the first day that I can give my second dose, if I get it in time. So I honestly don't know the answer to that. I know that they're allowed to go to any, provider that has a second dose. I helped the other HEB in town give a lot of vaccines, so I have a feeling that's going to cause some confusion, and I'm going to have a lot of their patients coming to me. So we're just going to have to work it out together. However, we've been doing it for 1A by appointment only, because we want to make sure to use that full vial of 10. So we will be making appointments for it. So we'll know ahead of time if we're not going to have enough to fill that 10 vial. And at that point, we'll move on to another health, or well, I guess we can't because it's a second dose. So I honestly don't know the answer right yet.
Okay, yeah, my question was, what are you going to do with those second ones? What if somebody, will you hold for a certain period of time and then say, okay, you didn't come back within 30 days, so we're going to go ahead and use them for somebody for a first vaccine?
As of now, I have to follow their rules, because they give, we have to submit to them what we gave, who we gave, which dose we gave. There's a lot of information that they require on every single vaccine. So I'm not going to go against what they're asking me to do. I don't have the answers for that right now, unfortunately.
Okay, thank you.
Yes, sir. I'm sorry, you can ask. It's going well.
I wonder about how you're going to handle, I guess, one day. I have a friend that's 83 years old, emailed me today. He lives in Brenham. Said he got a call from HEB last night, and he went in and got a vaccine. Are y'all going to be calling people once you get to 1B, or how?
So it's still up in the air. Originally, that was my plan. I was taking down names, I was taking down ages, because I didn't know what was going to happen. Since that time, HEB has developed an online schedule tool. Then we decided to team up with the county to try to help do a big clinic, so that it's not just trickling in. We can get masses done in a course of a few weeks. So I will will honor my 700 list that I've got going on right now that I already have on there. I'm not quite sure how, but as of now, I don't have a solid answer for you. What I can tell you is if you continue to watch the press, we will announce what we're going to do. Calling a store every day is not helping. But if you are just patient with us, we will give you that information just as soon as we know exactly what we're doing. We're still trying to get organized. And since we're trying to do it as a group, it's going to take a little bit for us to figure it all out. Since we have time, we have that available, that we can actually have the time to plan it and make sure that it's executed correctly. Yes, sir.
Several medical professionals, even locally, have been here on the news that don't intend or don't plan to take the vaccine. I'm sure they have the same information. You heard any reason somebody would get opposed to that?
No, I have not. I know that of the medical professionals in town that I've talked to, I don't personally know of any physicians who have said, I'm not getting that vaccine. Most of it are nurses, pharmacy technicians. They're just a little more apprehensive. They don't have that doctorate degree. They haven't studied it. Now, I'm not saying that there's not some physicians out there that are saying that they don't want it. And I don't know what the reasoning is behind it. What I can tell you is it's very safe. I got the vaccine. If I could give it to my daughter, I would. She's just not old enough. I feel it's very safe, and it will be very effective if we can just get the majority of the population immunized. It's going to be a game changer. It's just like pneumonia. You know what I mean? That's something that really affects people every day and takes a lot of lives every year. And the same with the flu virus. So it's just unfortunately another virus that we're going to have to beat.
I have a question.
I don't know the answer to that. That's another CDC state of Texas decision that I can't make. I would assume we're looking at anywhere from 70 to 80%, but I don't know the answer. Or don't quote me on it because I don't know. Yes, there was a question online.
We have a bunch
Yes, my wife and I both had the COVID, and she lost her smell. I mean, she was sticking her nose in a Vicks vapor rub jar and couldn't smell it. But now she has this sensation of smelling everything the same, like burnt vinegar is her. Is there anything we can do for that?
Is there steroids you can take?
What I can tell you about as far as taste and smell that people have stated is that it does get better with time. Some people it's a week, some people it's 2, some it's 3. It takes a long time for your taste to come back sometimes. Unfortunately, it's just one of the side effects of the actual virus that we can't control. So hopefully she'll get her smell and taste back rather soon, but I don't know the answer to that. I'm sorry.
Okay.
I have the same thing, but I smell like an old car engine burn with the gasoline burning. It smells like gasoline fumes, or sometimes like natural gas. So yeah, I understand that one. For those of us who have had COVID, how long do we have antibodies? I hear various reports on the news.
I heard various myself, so I would hate to just stick with one because I don't really know the answers to that. I tried looking it up. I even tried again last night. I mean, that question's going to come up. I can't find a solid answer to it. So unfortunately, I think it's just too new at this time to know. Until we start getting the vaccine and then testing for antibodies at a later time, we're not going to know that answer. I'm sorry.
Is there an effective antibody test now that's more than 50% accurate?
What? I'm sorry.
Is there an effective antibody test now that is more than 50% accurate?
I don't know the answer to that.
I haven't heard of one.
I honestly haven't either. There might be one out there, but I haven't heard of one. And I don't even know if we're doing antibody testing in Kerr County. Blood drives? Okay. Is there something you needed?
No, I just
yeah. Is there any other questions?
Amber, I think that Ashley Phillips has. Ashley, are you coming off mute, I think?
Yes, sir.
Excellent.
Okay, 2 things. One, it sounds like HEB has been a very strong partner with y'all. Are y'all is that an actual partnership? It sounds like with them developing the online tool that they're kind of helping. Is that just in this area with Peterson? Is that with other hospitals in other areas across HEB territory? Is that a recognized partnership?
No, so the HEB scheduling tool was developed for HEBs so that people could go online and schedule for it that night. I'm picking my HEB, this is where I'm gonna go, and what we would do is set up our times according to how much vaccine we have. So if I get 100 vaccine, I go in and I make 100 slots and let people go in and do it. Unfortunately, I think a lot of our community is a little technology like impaired. And so I see that it's not fair to some of them in our community. So I don't know how we're going to do that yet. And especially if we're going to do the community clinics, we will probably not use that tool, or at least not at first. Maybe that's something we integrate later. But as far as I know, that's not something HEB is doing with everybody. HEB here in Kerrville has teamed up with Kerr County because we have teamed up with them year after year for our flu clinics. And we've had a great partnership. So we're trying to continue that here in Kerr County. I do not believe it's that way in the counties.
Okay, thanks for answering. I had just one other question really quickly. And I apologize if you said something on this note earlier. The sound has not been that great on this end. Sometimes you cut out. But I was just wondering why the younger kids are not going to be vaccinated. Is it because they don't get affected so strongly? Or is it out of fear of a reaction with the vaccine? You know, what's the logic in that? And and whatever that may be, what is the plan for the younger population?
So as of now, it was not studied in any of the tribes. We don't like testing kids. Yeah, how it's going to affect adults. So it has not been tested whatsoever in any children. So we're not going to say, oh yeah, just go ahead and give it to your 5-year-old, not knowing what it's going to do. So the thought behind it is if we get enough adults to have the herd immunity, your children are going to be protected. So of course, eventually it will start being tested. There's going to be some that say, you know what, I'm going outside the lines. I'm going to go ahead and give this kid this because they're severely compromised. There might be a physician who decides to do that and sees what happens. And then those side effects and other things will be reported. But as of right now, they're not recommending that we give it to children because we just don't know the answers. We don't know if it's going to be harmful to them. Yes, ma'am.
Is there a way for Rotary and our members to help with regards to maybe the clinics, or how can we help?
So
That's
awesome.
volunteer.
I don't know yet, but that's awesome. I love it. So I will be, of course, we'll be in that Zoom meeting later this afternoon. I will definitely put that out there because we will need lots of volunteers, just like we do at the Ag Barn every year. I think we'll probably have the charter students do the temperature checks like we always have to have and those types of things. It'd be great to have volunteers. Unfortunately, with HEB, with my vaccine I get, HEB pharmacists have to be the one to vaccinate. So I can't, I've had some nurses call and volunteer to help, and unfortunately I can't accept it. But if it's like the hospital and they get theirs and their nurses can vaccinate, then at that one they can. So we're gonna just all put a team together, and we will have pharmacists from HEB come and help us so that it's not just the 6 of us here.
Keep us in mind.
Yes, ma'am, I will. Thank you.
One more question.
Yes, just one more question.
Amber, I do have something that's important at the end of this. We need to have Mark McDaniels make a statement at the end of your talk about what he's working on.
Okay. Okay. Yes, sir.
A number of us are on the HEB list before we discontinue.
Yes.
I appreciate your saying that you'll figure out a way to stop.
Yes.
But is there anything else we should be doing at this time, or just sit tight? Do you have an opportunity to figure out how you're going to do it?
Pretty much just sit tight. I'm hoping, and it just depends on how much I'm given, and when we finally finish 1A, how I'm going to have to proceed. It might be that we are going to do the big community clinic and I have all of you guys come to mine. We might still do it by appointment only. I don't know how they're going to do that because I don't want, like Tammy was mentioning earlier, in Florida, it was this mass panic and these people overnight waiting, and I don't want that to happen here in Cook County, and I think that we can rise above that and find a new way to do it so that we don't have this mass panic. I just don't know the answers yet. So we will work on it very diligently and try to get that out to you guys. And then let the press know so y'all can get that information. And I can always let Tammy know so as well so she can deliver that information to you too. This is another resource.
Thank you.
Thank you.
Thank you. I'd like to have Mark McDaniel come on and make a statement, please. Tammy, can you hear me?
Yes, I can hear you. Is
Mark
Mark on?
McDaniel.
Yeah, okay. Well, thank you. Thank you, Dave, for setting that up. And Amber, great job. You've been such a tremendous partner working with the rest of the community and taking a leadership role with HEB. As usual, HEB has been such a great corporate citizen for us. So this has been a moving target, as Amber has alluded to. We've had plans in place and had to scrap plans and put new plans in place and scrap those and so forth. And it all has to do with the availability of the vaccine. So we've got different approaches that we're pursuing. And as she mentioned, there's a task force in place that includes primarily from the city side, our fire chief, who's got some medical background, working with the county, Peterson, the pharmacies, and a number of other groups. In addition to that, we've got a community update tomorrow at 4:30 that you can catch with probably some updates to what Amber has provided. It's going to be live streamed on our website, and it's also going to be posted on our Facebook page. But prior to that, we're going to have our regular community leadership meeting, which again would involve folks like the mayor, county judge, commissioners, Peterson, medical professionals, the school districts, and a number of other individuals. And then we do the report out then after that at 4:30. So we'll be able to provide any updates to what Amber has provided on the vaccine, and you might find that informative. So I just want to make sure that you all were aware of that.
Thank you, Mark. Okay, guys, I want to first of all say thank you to Amber. This is the one question you hear all day long when we're just walking around. I know she does too. So it was so sweet of her to come here and knowing that she's going to be bombarded by questions, and she's done an excellent job. I want you to also know I actually know she's a little emotional because I asked her, but I was there the day that she was her very first vaccine, and it was something really special. It was historic, and I know she had 100 in 2 days that she was going to distribute, and she didn't do it where they came to her. She was mobile, going to 100 people over those 2 days, and I just want you to know she's dedicated and awesome, and I think we're lucky to have the fire department, Doug Thomas with the county, and the city of Kerrville working with our private partners to be able to do what we need to get done. So I think when they do these clinics, you'll be happy to go there. It'll be well run, it'll be very organized, and it won't be difficult for us to get. So again, thank you for all your work, all your hard work. Thank you to Mark, thank you to the city and the county, everybody involved. But with that, now we have some business. We haven't seen each other in what, 3 weeks? It's been a long time. And I missed you. I don't know if you missed me, but I missed you. And we still have work to talk about for Rotary. So before our last meeting, I asked you to let us know if you were going to be attending in person or not attending in person. That Gina, to be able to help her with billing, was going to bill for lunches. We did hear from some people, so when your invoices went out and if you did not respond, you were all billed for lunches. Please help us make sure that those get paid. Please help us make sure that they get corrected if you need to correct it, if you don't plan to be here in person. But we want to mainstream that because there's enough stuff going on that it's hard to keep up with 140 people and their individual wishes each week. So we want you to help us with that. So your invoices went out. Please help us get them paid. Please help us get them corrected if they need be, and then paid. So thank you so much for helping us with that. We did hear from some people, and I haven't heard that there's been any problems since the invoices went out. So hopefully that's streamlined and going well. And thank you for your patience and your participation in helping us get that done. We also have Dave Samuel. Are you online, Dave?
Yes, can you hear me, President?
Yes, we can hear you.
Excellent. Well, good afternoon. And first of all, this is just our first meeting since we finished bell ringing, and it was a fabulous success. Thank you all for coming out, supporting the effort. Especially thank the people that rang. That was super. If you wanted to ring but didn't have a chance, I suspect the need will occur again next year. So thank you for helping make it better for the Croc and for our community. In a related note, I just hope maybe the task force will find a use for Rotary in their needs. And so if we can help them with COVID or the prevention of COVID, I think it'd be great. Okay, thank you, team. Thank you.
Thank you for doing on the well-being, and thank you so much for doing that because I would be very, sure.
Tammy, you're not close enough to the mic.
Thank you very much. Is that better?
I'm not sure why you're fading out, but relative to the computer, maybe, I don't know.
I don't really know what to tell you, but I just wanted to thank Dave. So he did a great job. Also, do we have Todd Odom online? Kind of hard to.
Yes, I'm here. How y'all doing?
You have something to tell us?
Oh, yes, we have trash collection on Saturday. We'll meet at 7 o'clock at Cali Elementary, and I'll have food individually packaged and some drinks for everybody. And bring your friends, bring your neighbors, and we're going to knock it out.
Thank you so much, Todd. We really appreciate it. That's a good job. And we've stayed busy all through this COVID, and we've just been able to get back to our trash collection. So if you can help them, we really would appreciate it. Also on our blood drive, we're doing quarterly blood drives. The South Texas Blood and Tissue Center has thanked us profusely for helping them because they're in a shortage situation. So she's asked, instead of spacing out, could we have our next blood drive in the beginning of February? So I'll send you info on those dates. We will need or ask anybody that's willing to give blood, but they will continue the antibody testing. So if that's important to you, that's an added bonus to be able to see whether or not you've had it and didn't know and were asymptomatic of the COVID virus. Anyway, I will send out more information on that. I do have some wine to give away, and our first person is that we have in line for wine is Delane Siegerman. And if Delane Siegerman has her pin on, she is entitled to a bottle of wine. Are you there, Delane?
Yes, it's not on me, but it's in my house. So no, I'm not wearing it, but I do have it in my bedroom. So I don't know.
Judges, what do you think?
Yeah, give it to her.
Sorry. People here said no, I'm sorry, Delane, but I would.
Do what you want. It's okay. I should have put it on.
Okay. So the next person that we have is Jill Sadler. Do you have on your pin? Oops. Uh-oh. One is Wayne Eager. You have your pin? Yay! Okay, Bob Schmidt was next. So we're giving away that wine. I don't think that we have enough time for breakout sessions. So I think that we'll just call it here. I don't have anything else to say except for I truly wish each of you to have a wonderful 2021. I pray for health and our businesses to be prosperous again, and that we all just feel normal and safe. So what my hope is. I have a question over here. Yes, Carol. We've been off the meeting. I would like to invite Jeff Harris to introduce our guests.
Amber, thank you. Yeah, I kind of forgot what it's like to be up here, but hopefully everybody had a wonderful Christmas and a great New Year. So we do have some Rotarians with guests today. I'm going to start with Carol Holmes. You have a couple of transfers that you'd like to introduce to us. Okay. We have Debbie Andrews is visiting, as well as Donnie Oswald. Thank you all both for being here. And welcome to the Noon Club. Thank you all. Mr. Winley, you have a couple of esteemed guests with us now that I can speak for one of, but if you'd like to introduce. I probably could, but I won't. For those of you all online, we have Sheriff Leith here with us. We had Sheriff Leafy is with us today, as well as the new Chief Deputy Chris Blond, and Kenneth Wilkie was with us as well. So thank you all. And I will hit real quick since I'm up here and I'm here. Tickets for Super Bowl will be coming very soon. And also, just to plant the bug, on the 12th of April, that's a Monday, Comanche Trace First Responders Golf Tournament, just to start planting the seed for that. Oh yes, and February the 3rd, for what our First Responders Golf Tournament does, we will be having our First Responders Luncheon and Awards presentation.
Okay, guys, I hope you have a great week. And with that, if you'll join me in the 4-way tips. Of the things that we think, say, or do.
Is the truth.
Is it the truth?
The truth.
Is it fair to all
Fair to all
concerned?
concerned.
Will
Will build goodwill and better friendship. Will it be beneficial to all concerned?
Bye, guys. Have a good week.
Bye-bye.
There.
Baby.